Good morning, Tobago on Tobago Updates. Viewers, now we are switching our conversation to Medical Lab Professionals Week because it is Medical Labs Professional Week. And to tell us more about that, we are being joined by Miss Samantha Alexis, and she's the acting manager of the laboratory services, as well as Miss Charmaine Lewis, who is a registered midwife, and is assigned to the blood donor room at the Scarborough General Hospital. So good morning and welcome to you both.
Good morning. Thanks for having us.
Great. So let's get started with just the explaining what is Medical Lab Professionals Week, why are we celebrating it, or why are we observing it?
Okay, so Medical Laboratory Professionals Week, it actually originated in 1975, and it was the National Medical Laboratory Week by America. And throughout the years, there's been many campaign supporters, and it's now actually celebrated internationally. And this year is the 49th installation of this. So it's a time that we could actually bring recognition to the profession, as we are often hidden. Most persons aren't aware of the lab and what we do. So it's a time to bring recognition to these professionals.
So on that point, then tell us, what do you do? What is so special about the team that you guys are?
So as laboratorians, we play a major role in the healthcare. We assist physicians to diagnose diseases, treat diseases, and even prevent diseases. And we do this by giving out accurate and reliable test results so that the decisions that the physicians make is actually evidence-based.
And Mr. Lewis, just give us an idea of just being able to work there, being able to be part of all of these services, and being able to give the answers that the doctors and technicians need to be able to administer care to the patients.
Well, we are arm of the lab. We really do donations. We bleed people to get blood, so that patients could get blood that save lives.
So, yes, great. And so, just give us an idea also of when does this week take place? Is it every year?
It's every year. It's celebrated in the month of April, and this year it's celebrated April 14th to 20th.
And then what are some of the activities that are in place?
Oh, well, we have an action-packed week. Starting from Monday, we are having an opening ceremony at the Scarborough General Hospital, and it's followed throughout with various activities. So we have, for example, lunchtime lecture series, which is delivered by various doctors in different specialty areas, and laboratory demonstrations that we would have live. So patients and members of the public have an opportunity to come in and see actually what do we do. We also have some social activities planned. We have games night, we have karaoke session. Even Sunday, next week Sunday, that is on Pigeon Point Beach, we have a sports and family day. So we are inviting persons of the public, other health professionals to come along and join in our celebration.
All right, so tell me a little bit about even the specialities of the lab and so on, and lab technicians. Tell me about exactly what you do, and just even some of those tests that you say that we're going to be able to witness as a public.
Okay, so at the laboratory have various specialties such as microbiology, which is the study of microbes, these tiny organisms we can't see with our naked eye, so we have to use, for example, a microscope. We have areas such as hematology, immunohematology. So in the live demonstrations, persons will have an opportunity to see how we actually can see a blood group. And this is important when we are doing transfusion services, and this is where blood bank nurses also come into play, where they collect that blood for donation and transfusion purposes. So during this week, we are also encouraging persons, come on over to the hospital and donate blood as well.
Certainly. And I mean, we're going to talk a little bit about the blood donation part in just a bit. But I just want to focus even just on the fact that we actually have a very active, very diverse set of technicians there at the lab services. Tell me about even just some of the members of your team. that does this hard work every day?
Okay, so we have different categories of staff, such as lab tech assistants. So what they would do is help to prepare the samples for the lab technologists who work in different areas. So let's talk about microbiology, for example. These persons are going to come in. Let's say there's a urine sample. So you're getting some pain in the back, pain while urinating. You'd want to know, well, why is this? So doctors might think perhaps it's a urinary tract infection. So these persons in the microbiology department is going to take that urine and they're going to work it up by means of what we call a culture and sensitivity to determine the microorganisms that is causing the infection, and then be able to tell the physician these are the antibiotics we can use to treat that particular infection.
And then, how does young people, how do young people like consider a career in lab technicians and so on?
Okay, so if you have a passion for science, you love solving puzzles, it's a good field. So how you get into it at CXC level, you have the biology, chemistry, these science subjects, and then we move on to an associate degree. So the associate degree is entry level, and from there we can go on to specializations by means of even master's degrees, PhD, and specialization in different areas such as hematology, which is the study of blood, cytology, histology. So it's an area it has a broad scope.
And is it that, as you say, like even after you come out from high school and after you get your associates, you can even start to work, and then as you work, you continue to increase your qualifications?
Absolutely, yes.
All right. And then, so tell me a little bit about just the blood donor clinic at the Scarborough General Hospital, Miss Lewis. I know that's your field.
Yes. Well, I'm one of the nurses attached to that department. We are the ones collecting the blood, talking to the clients as they come in to donate blood. So we ensure that they do so safely and comfortably, right? Donation is very important in the life of hospital and in the public life, because once persons are diagnosed with certain diseases such as cancer and even diabetes and high blood pressure, they develop problems sometimes when these things are not controlled. And so they may need blood. So we at the blood bank, we are there to assist in that area, asking healthy persons to come and to donate blood.
What are some of those myths that people have when it comes to donated blood?
Well, yes, they have a lot of myths. One of them, a popular one here in Tobago, is that if you have a tattoo, you're unable to donate, but that is not true. The tattoo must be over 3 months old, right? And once the 3 months have passed into the tattoo, you are able to donate, right? Another myth is that you're draining out the person's blood, but you're not doing that. Blood, after 3 months, you get back new blood cells, and your blood count goes back up intermittently. The 2 days after, from drinking lots of fluid, your blood volume goes back up to normal, and then the cells regenerate themselves, right? So you feel more energetic and stronger.
Well, I was just about to ask, because I know that there are studies to say that it is beneficial for you to occasionally give your blood, donate your blood.
Yeah, because it protects you from disease like heart failure and stuff like that, and it's an easy way to get a quick health check, So there are benefits, lots of benefits to donation. And as the client comes in, we educate them as they come to donate. And then a lot of them say, well, I didn't know this thing was so easy, because it is. A lot of folks fear the needle, right? But the needle is a part of the process in order to get the blood, because there's no other way to get the blood, right? So the needle has to be used to get the blood, right? So we alleviate the fears of the client when they come in, and we ensure that they are comfortable. We do an interview, right? Asking certain questions to ensure that that person is safe and able to give. We want to protect the donor, and we want to ensure that we get the safest possible blood.
Now, is there anything in place for this special week? Like, is there the blood donation that's happening this week? Is there anything special for those who come forward?
In the terms of what?
Just anything, it's there like a little treat. I don't know.
Yeah, well, we are trying to get tokens to give out to the clients as they come to donate, and along with education. So that's what we plan to do.
How often does having that blood on standby been instrumental in saving lives at the hospital?
All the time.
Every day.
Every day, yes. And
Every day.
This year we have noticed a lot of persons needing blood. A lot of persons needing blood. And not just ill persons who would have gotten into accidents, and stuff like that. So blood donation is very important, very, very important. And we really want to encourage the public to come and donate, right? When you come, we are there to educate, as I said before, and to encourage you in the process.
And then, of course, when you get the blood, it isn't just given to the patient just so they.
No.
That's why you have the lab.
Yes.
And then tell me about that process there at the lab, or what happens when the blood is collected.
Okay. So when blood is collected, we actually have to have it screened, and that screening process is to ensure that it doesn't have transferable infections. So that is done actually in Trinidad. There's a national hub for NBTS, that is called. And then at the laboratory, what doctors will do is take blood from the patients who would like to receive blood, and we will have to cross-match. Cross-matching is a process whereby we have to determine the compatibility to say, okay, this person's blood and the donor and the recipient blood is not going to have an adverse reaction. So that's basically the process there.
All right. Well, we got to go for a quick break, and we'll be right back just after this. So don't go anywhere.
It's a brand new month.
Welcome back to Good Morning Tobago on Tobago Updates. Viewers, we are discussing Medical Lab Professionals Week, and that's coming up next week. It's coming up next week. And so, of course, we are speaking this morning with Ms. Samantha Alexis, and she's the acting manager of the laboratory services, as well as Ms. Charmaine Lewis, and she's a registered nurse and midwife assigned to the blood donor room at the Scarborough General Hospital. Now, of course, that blood donation drive is something that's going to be a very important part of Medical Lab Professionals Week, because, of course, we need blood within our services, and we discussed that a little bit before we went to the break. But what's the process for those, like I said, because it involves needles, and we have a fear of needles.
Yes.
I included. But what is the process?
All right, the process is simple. It takes about 45 minutes for the whole process to be completed. The client comes in, we introduce ourselves, of course, and we take them into a private room. We do vitals, which is the blood pressure, the height, and the weight. And we do the blood count, which for males must be 13.5 grams per deciliter, and females 12.5. Once we ascertain that everything is okay with you, health-wise, we go ahead and write up a bag, which the blood is bleed into, and we take the person into the next room where we actually do the bleeding process. Right? There are specifics for that blood donation, that your pressure must be a certain level and stuff like that. Right? So we put the person on the chair, make sure that they are comfortable, and then we clean the area before we do the venipuncture. The venipuncture is getting into the vein. Once we find a good pliable vein, we insert the needle and we let the procedure take place. The person has to squeeze a ball as they go along every 10 seconds and until the process is finished. Now we collect in the bag 450 milliliters of blood. The bag contains 50 mils of anticoagulant, which as the blood is drained, it mixes so that we don't get any clots. Right? So after that is finished, we offer a drink. Right? Sometimes if the person wishes, we may offer a next one, and we encourage them to hydrate for the next 2 days and lessen their physical activities. Right? So.
And then when it comes to, finding that vein, because again, that's also another challenge.
Oh, yeah.
Now, tell me about just the difference when it comes to blood donor nurses doing this as opposed to regular doctors.
Well, we have to find a vein big enough to insert the needle for the blood to come at a certain rate, right? So we usually go at the point of the just over the elbow there, and we do that process.
And of course, you guys are able to find it sometimes a lot easier.
Yeah, we apply the blood pressure cuff, and we increase the pressure up to a certain level, and we proceed with palpating the vein. Once we get a good vein, we start our procedure, right? Yes.
All right, and of course,
I wanted to add one thing. Persons who are coming to donate, before they come, they think that they want to, they must hydrate well. Right? They must have a lot of fluids, water and stuff before, the day before and then the day that they are coming. Okay?
And then where are you exactly in the hospital are you located?
Well, we are right behind the dispensary area where the lab is. As you enter that door, we have 2 rooms there, and then you just say what you come for, and we are there most of the time, or the lab staff would inform us that we have clients. Right?
And what time is the lab opened?
For blood donation, we are there from 7:30 in the morning till 4:30 at evening, where we take our last donor at 4. Right? So we work till 5, but we take our last donor at 4.
So, and then tell me a little bit again about just some of the activities that we have planned for Medical Lab Professionals Week. And of course, because we want people to be involved, and I'm very much interested in some of those lectures and the demonstrations and so on.
Okay, so Monday is the opening ceremony where we officially recognize the start of Medical Laboratory Professionals Week. And then Tuesday, we start with a lecture series actually in the outpatient clinic setting to really give patients and members of the public an idea and understanding on the importance of blood donation, understanding their blood groups and the importance that it plays actually in saving other people's lives. And on Wednesday and Thursday, this is the lunchtime lecture series, we have presentations by our pathologist, Professor Daisley, who is going to have a discussion on the impact of COVID and what they are seeing in the postmortem in terms of test results and whatnot. And also we are having a presentation on palliative care and the correlation between blood test results that you'll see along that time. So these are some of the activities that we will be having.
And what time are those lectures?
12:30 to 2 p.m.
And so anybody could come to that?
Yes. Yes, members of the public are invited, patients, other healthcare professionals, they are free to come along. And the laboratory demonstrations that we would be having 1 p.m. is in the general courtyard area. And persons could come along, they get an idea of how we do pap smears, how we do and process histology samples, how we process samples in our biochemistry department, such as glucose tests. A lot of patients will come to the hospital and we tell them, well, you need to fast before you do a fasting blood glucose test. And they may be a bit irate. Why is it that I have to stop eating from 7 p.m. the night before? But now you have the opportunity to understand the importance of fasting and properly fasting and preparing yourself for each of these blood tests and understanding the impacts that would happen if you don't follow the instructions. So that's the basis of our live demonstrations. And then we have a little free up session, all work, no play makes us dull. So we must have a little stress-free session where we'll be having games night. And as you come to donate blood, you are free to join us in our games. So we say games night, but it's really 4 p.m. to 7 p.m. as Miss Charmaine would have just said. The last donor is taken at 4 p.m. So you could come at that time, join us in playing some fun games, join us in our karaoke session, and on Sunday, come and meet us on the beach. And we just have a fun, relaxing time.
And how much are you looking forward to just being able to share this information with the public?
This is a very lovely day, I must say, because it allows us to connect with the patients. We are oftentimes viewed as robots. People might just think all we do is press a button and you get a test result. Or some persons may not even think about it. But being able to form that connection and understand that we are all humans and we are professionals and we have put in years of study to understand, yes, when we give out a test result, it's the true result. You don't have to second guess it. So it enables the members of the public to have more confidence in us, have more trust in us, not just the members of the public, but other healthcare professionals. And it helps to bring forth a sense of unity. And therefore, we can approach the healthcare setting in more of a team setting, a team mindset. We appreciate everyone, we respect everyone, and we work harmoniously together.
All right, great. Well, I want to thank you so much for being on with us and for sharing that. And we are certainly looking forward to next week, seeing you in action and seeing you for those live demonstrations and so on. And of course, viewers, please come forward and donate blood. We actually do have a shortage of blood here in Tobago. So we need to make sure that our blood bank is at a certain level. So come out, it's good for you. If you don't know your blood type, they'll take care of that as well. So, and it's a good way to find out what your blood type is. So come and donate blood next week. All right, so thank you again for being on with us. And viewers, I hope you have a safe and wonderful weekend. And we will see you again tomorrow. On Monday. Bye for now.
I say, thanks for